Good morning, everyone, and welcome to this webinar held by the Office for the Prevention of Family and Domestic Violence. My name is Nikki Coslin. I'm the Acting Executive Director for the Office, and I'm joined here by Selena and Stacey, who are the managers in the Office. Before we kick off, I would just like to acknowledge that we are meeting on Whadjuk Noongar Boodja and pay our respects to Elders past and present. Did you want to go to the next slide? Thanks. So today we will be providing an update on the CRAMP review. Selena will be talking about the 16 Days in WA campaign, which is ready to be, which will kick off very soon. And also Stacey will provide a very quick update on the 50 additional positions that were announced today in the media. So if we go to the first slide. As you're all aware, the first current state analysis phase is concluding. We've had 9 focus groups so far and many individual discussions with key stakeholders. We've done a targeted literature review, including best practice, and a scan of frameworks in other jurisdictions is also underway. And key recommendations report is being prepared. An overview of the findings and next steps will be presented at the next webinar, which is today. So that slide probably should have been updated. But to provide you with a little bit more information, I have Claire Rapson from Ernst & Young online. So I will hand over to you, Claire.
Thanks so much, Nikki, and hi everyone. Nice to be online with you all again. So I guess as Nikki alluded to, and as many of you know from our recent webinars and communications sort of across the sector, one of the Office's key priorities at the moment is to review and revise the Common Risk Assessment and Risk Management Framework, or the CRAMP. And for those of you who don't know, my team and I have been engaged to support the Office with developing an understanding of how the CRAMP is sort of being used across the sector and sort of any opportunities for refinement of the CRAMP. As Nikki said, we'll kind of be consolidating our findings in a key findings and recommendations report, but to kind of develop these findings and recommendations, we've been engaged to facilitate 10 focus group discussions with practitioners from across the sector. I think we've probably spoken to many of you on the line today, and have now sort of facilitated 9 out of those 10 focus group discussions, and thought that today would be a good opportunity to give you an overview of some of the key things which we've been hearing from you to date. Of course, really welcome any questions which you have for us, so please pop them in the chat, and I think we've got a decent amount of Q&A time at the end, so really happy to sort of address those then. So I don't know if you just want to flick to the next slide there. So as you can see sort of on the screen there, we've consulted with these 9 groups of stakeholders. So I had an initial consultation with Safe and Together practitioners, spoke to the peak bodies, FDV-RT representatives, Department of Health, Department of Justice, 2 focus group discussions with specialist community sector family violence providers, a focus group discussion with providers who work largely with First Nations community members, and then a focus group discussion with service providers who work largely with COLD community members. As I mentioned, we do still have 1 focus group discussion to go, which is going to be more with kind of ancillary stakeholders who do a lot of risk screening, but don't work sort of in specialist family violence roles. So yeah, as you know, the focus of our discussions has largely been on the CRAMP document itself and sort of any opportunities for refinement of the practice tools and guidance within that document. But obviously the CRAMP is just one component of an integrated service response to family violence, and there are many enablers of the CRAMP and different considerations which have come up in our conversations, which we'll also be documenting in our report. But today we thought we'd just give you a quick overview of what we've heard in relation to risk screening, risk assessment, risk management, and the overarching framework and guidance in the CRAMP. So Zoe, if you just want to flick to the next slide, thank you. To start with risk screening, so as you all know, the CRAMP includes a risk screening tool as well as a practice guide on risk screening and a number of fact sheets which are relevant to risk screening, so relating to forms of family violence, indicators of family violence, perpetrator characteristics, and how to determine the primary aggressor in a particular relationship. I think what we've heard from most of you in relation to the risk screening tool is that most of you actually don't use a risk screening tool in your client-facing kind of interactions. And that's because you're largely kind of engaging in risk screening in a more conversational or organic way, which is really kind of consistent with best practice and exactly what the CRUMP indicates that you should be doing. But a number of you did reflect that this kind of more organic way of doing risk screening and not having a client-facing risk screening tool means that the risk screening process is really only as powerful or as effective as the person who's conducting the risk screening. So a lot of you reflected that there's a real need for regular training around how to best conduct risk screening. And as you can see, that's kind of a common theme which we've heard across, I think, the risk assessment and response process. But in terms of feedback on the risk screening tool itself, we did hear that there were a number of sort of opportunities to refine the tool. Firstly, the language and format. I think a lot of you felt that the questions could be a little bit less direct and a little bit less clinical. So including sort of broader or less direct questions like how do you see your relationships with family and other people, or how do you deal with painful feelings or the bad things that have happened in your life. Those sorts of less direct questions you broadly reflected would be more useful than the more kind of clinical or sort of quote unquote invasive questions kind of included in the tool. Some of you did suggest that it might be useful to have a risk screening tool, which was sort of client facing, but that it would be useful to have sort of a more visually engaging tool which you could use directly with that person instead of that kind of survey-like approach adopted in the current tool. We did hear a lot of feedback that people generally don't feel comfortable or equipped to screen for family violence risk to COLD and First Nations community members, and sometimes don't have sort of a strong understanding of the unique types of family violence and barriers to reporting family violence risk faced by these communities, or kind of feel that they have sort of the capabilities to screen for family violence risk in a culturally sensitive and appropriate way for those communities. Some of you did reflect that in some cases you're actually not screening for risk because you don't always know what to do if risk is identified. So it would be useful to have kind of a clear and practical overview of sort of next steps in the CRUMP to support with that. And then finally, the CRUMP does kind of include a list of different agencies or organisations that are responsible for risk screening, but we heard from you that this list sort of misses some important agencies like maternity services or EDs, which should be included in that. So Zoe, if you just want to flick to the next slide. Thank you. So we heard a lot of feedback relating to the risk assessment tool and guidance in the CRUMP. So I guess, as you know, at the moment, the CRUMP has that common risk assessment tool, which uses that sort of structured professional judgment approach to assessing risk and categorising risk, but also has a risk assessment practice guide and a number of fact sheets which are relevant to risk assessment. I guess, like I said, a lot of very detailed feedback provided on the risk assessment tool in particular. So for the purposes of this presentation, we've really just consolidated these takeaways into kind of 6 overarching findings. So firstly, we heard a lot from practitioners, and particularly those in sort of non-specialist family violence roles, that the risk assessment tool can be quite lengthy and time-consuming to complete. A lot of different agencies said that you'd adapted the tool to make it a bit shorter or more relevant to the unique types of family violence that are sort of most likely to present themselves in your specific contexts. We did hear that the risk assessment tool is currently quite focused on adult intimate partner violence, and there are opportunities to Refine the tool to include considerations that should make it more relevant for broader types of family violence. So, for example, capturing multiple perpetrators or family contexts, capturing risk factors relating to children and young people, elder abuse, and considerations for priority populations groups. So, risk factors relating to honour-based violence, or migration or visa status for COLD community members, and sort of more risk factors and considerations for First Nations, LGBTIQ and community members with disability as well. We did hear also a lot that many of you feel that the tool in its present sort of state doesn't support you to capture patterns of abuse or coercive control, including tech facilitated abuse. It's currently sort of quite incident focused with that sort of yes, no kind of response, instead of sort of supporting an understanding of patterns of behaviour which might be escalating in a certain case. And then I guess point number 4, or 3 and 4 there, some practitioners don't seem to find the tool sort of as useful for risk assessment purposes, either because it's too long or because the triaging of risk under the tool, so at risk of harm or at high risk of harm, isn't always helpful to sort of determine what next steps should be. So it means that in a lot of those cases, the risk assessment tool is being used to identify risk factors or as kind of a referral tool to support referral to other services, but not sort of as a way to triage risk and determine next steps. Point number 5, we heard from a lot of practitioners working with perpetrators or people using violence that it's very victim survivor focused and isn't a tool which can be used when you're working directly with perpetrators, so not as relevant to their work. And finally, like the sort of risk rating tool, the way the tool is being used across the sector does seem to vary a lot. So many of you are using it as a client-facing tool because you don't necessarily feel confident undertaking risk assessment without it, but some of you are using it more as a conversation guide. Others are not sort of bringing it into the room with them at all. So it again sort of means that risk assessment or the quality of risk assessment can be quite dependent on the skills and capabilities of the person undertaking the risk assessment, which kind of again points to that need for really regular and consistent training on how to undertake risk assessment. If we just move on to the next slide, Zoe. So I think we might be missing a slide there. I might speak, I'm not sure if you have the risk management and safety planning slide there, but I can speak broadly to no, I think it's probably just one missing the deck, but I can just speak broadly to risk management. So we had kind of split that into kind of the safety planning tool and then the sort of MACM tools. I think for the safety planning tool, we again heard that it's quite lengthy and largely you're not using it as a client-facing tool that you're completing in partnership with victim survivors, but using it as a guide in many cases. And that's often because it's not sort of the safety planning considerations outlined of the tool are not always closely linked to the risk factors identified in the risk assessment tool. And so you're obviously only going through kind of safety planning considerations which aren't relevant to that specific victim survivor. There were sort of a number of opportunities pointed out to enhance the safety planning tool to make it sort of more aligned with Safe and Together, so more of like a strengths-based focus on what the mother is doing to protect herself and her children despite the perpetrator's behaviours, and really working with the victim survivor to identify what they're currently doing, which is working well in terms of safety planning. And then we also had some discussion around the MACM tools included in the CRAMP. As you know, there are currently 4 MACM tools in the CRAMP. So there's an agenda, a consent form for information sharing, a confidentiality declaration, and a multi-agency safety plan. So I think we heard from some of you that 4 forms or 4 different tools can be quite a lot, and there's a possibility an opportunity to consolidate these to some extent. But we also heard that the multi-agency safety plan in particular could be refined to encourage greater accountability for each agency's actions following a MACM as well. And then finally, this slide here on the overarching framework and guidance. So a few opportunities sort of identified here. There was sort of some confusion across the sector on what the purpose and desired remit of the CRAMP is intended to be, so who it's intended to be used by and when, which really sort of suggests a need to develop a really clear vision for the CRAMP, including really clear roles and responsibilities for all the agencies who play a role in responding to family violence risk. Second point there have obviously been a number of changes to the legislative and policy landscape since the CRAMP was last reviewed. So these will need to be reflected in the updated version. Some of the feedback we had was particularly around sort of including updates to which have been made to information sharing legislation, legislation relating to non-fatal strangulation, the role of FDVRTs and that kind of multi-agency response to family violence, making sure that that's all included in the CRAMP. And then I guess point 3 there, in terms of additional guidance, we broadly heard from you that you felt that you could use more guidance around screening for, assessing and responding to family violence risk with COLD and First Nations community members, with perpetrators of violence, people using violence, children and young people, including in the context of adolescent family violence. And then finally, point number 4, as I kind of already alluded to with the safety planning tool, I think it was broadly felt that language sort of throughout the framework and tools could be reframed to be sort of more aligned with that safe and together language and framing. If we could just jump to the next slide, please, Zoe. Thank you. So yeah, as I mentioned at the start of this sort of overview of findings, the focus of our discussion has really been on the CRAMP document itself, but naturally the CRAMP is just one element of an integrated service response, and a lot of sort of considerations relating to actual implementation of the CRAMP were also raised in our focus group discussions. So I've put some of these on the slide. Firstly, as I've mentioned a couple of times, it was really, we really heard from a lot of stakeholders that we really need good sort of training and capability building around use of the CRAMP. Secondly, the need for stronger and clearer information sharing practices and processes is really important in that multi-agency response. Thirdly, a few stakeholders sort of identified an opportunity to consider how we can use data being collected during that risk assessment process in a way which is, of course, respectful of data sovereignty and people's privacy, but can also be used to understand what sort of family violence looks like in our communities and support the development of appropriate service and policy responses to family violence as well. Fourthly, a lot of stakeholders felt that technology was not kind of being harnessed as well as it could be in this case. So enhancing that technology could really enhance the sort of effectiveness of and sort of consistency of that multi-agency response, even just sort of digitising the risk assessment and screening tools. And then finally, as we've sort of already touched on, the CRAMP in its current format largely relates to adult victim survivors in intimate partner sort of contexts and sort of victim survivors who aren't from more marginalised communities. So there needs to be kind of more guidance in the framework around what a common response to family violence risk looks like for perpetrators and people using violence, children and young people, and victim survivors from priority population groups like COLD and First Nations community members. So just jumping to the last slide, Zoe, thank you. Yeah, I'm conscious that's sort of a lot of information in a short amount of time, but hopefully that's a useful overview of some of the kind of initial findings that we've sort of heard to date during our consults. As I mentioned, we do still have one focus group discussion to go, which will be sort of largely focused on risk screening undertaken by agencies that work in sort of those ancillary sectors that don't focus exclusively on family violence. And we'll then sort of submit our key findings and recommendations report to the office, and there should then be sort of a process of refinement and validation of that refined CRUMP commencing next year. So I'll just pause there. I don't know if anyone has any questions at this stage. Otherwise, really happy to take any on notice. And yeah, going back to you, Nikki.
Great, thank you, Claire. There are no questions currently in the chat, but if anybody online has any burning questions, please feel free to contact the office and we'll get in touch with Claire and make sure that we can provide that information to you. Yeah, I was going to give it a minute, but no, that hasn't prompted anything. So thank you so much, Claire. Oh, there is one. Sorry.
Has the MAFCAM process been reviewed as well?
So that's not part of our scope of work with the CRUMP review. That might be one which the office is better placed to respond to. I don't know, Nikki, if you wanted to speak to that. Celine.
I am unaware, but I will double check and come back to people, if that's okay. No other questions? All right. Thank you so much for your time today, Claire. We probably continue to provide updates on this project as we continue on our journey. I will now hand over to Selena, who is going to provide you all with a bit of an update on the 16 Days in WA campaign for 2023.
Thanks, Nikki. Kaya, everyone. For 2023 16 Days in WA Stop Violence Against Women campaign, I know at the last webinar, Nicole gave a fairly comprehensive update. So this is really just to let you know about some more campaign resources and activity that's come online since that last update. But I'm assuming a fairly good level of knowledge in the audience about 16 Days in WA. It's the state government's annual campaign to focus on the issue of violence against women. And this year's campaign theme is Stopping Family and Domestic Violence, Play Your Part. So we're really focusing the campaign on people, no matter where they are in the community or which organisation they work for, can really activate around the campaign and its focus. So we're about just over 2 weeks away from campaign launch date on the 25th. So we now have a campaign hub, effectively a website up and running, and the hyperlink when you get this set of slides will work and take you directly to that hub. And there's a lot of material on the hub, a message from Minister Winton as the sponsoring minister of the campaign. We've reworked some of the activation pieces into 16 ways to play your part, and that's really organised around people either finding out more about the issue of family and domestic violence or taking specific action in their community or area of influence related to the campaign. We've also got a whole lot of digital resources, and they're under a particular tile on the campaign hub, and you can see a copy of the campaign poster there on the slide. So we'd really encourage you to look at those resources, download them and start utilising them. We've also got a function on the campaign hub which enables organisations and individuals to register any events that they are running through the campaign period. So we really look forward to you registering your event if you haven't already, and then our intention is to promote those on the campaign hub as well. So that's another engagement point for people. We also, I'm happy to report, but it might be a bit disappointing for some people, we have exhausted our 20,000 supply of badges this year. We just got ours this morning, which we're happy to be wearing, and we know they're a really popular resource with the campaign. So I hope that a number of you were already on our mailing list and got the notice to register for a quantity of badges, and that you will be receiving them very shortly if you haven't already. So really going with the campaign theme, this is really just to acknowledge that it is a very particular time for specialist services and other organisations in the community sector to activate around the issue of stopping family and domestic violence and violence against women more broadly. And also acknowledging that it comes before a fairly intense period for specialist services leading into end of year and Christmas, when we know there really is an uptick in terms of incidents and reporting. But really looking at the campaign as an opportunity to have stronger community engagement on the issue, which hopefully over time translates into better community understanding about the issue. So that's it for where we're up to with the campaign at the moment. And if there's any questions, happy to try and answer them now if they're coming online, or take them offline.
Great, thanks, Selena. I will go back. I have a crowdsourced answer for the Macam question. So thank you to Rachel for coming to my rescue in my time of need. So the Macam packages are being reviewed by the FDVRT team. And the next question that we have is actually about something that Stacey was about to provide an update on. So I might throw to Stacey first, and then if she doesn't answer this question, then we can answer her. So over to Stacey.
Thanks, Nikki, and hi everybody. I'd like to give an update on the expression of interest for the frontline community workers. We spoke about this at the last webinar, but many of you may have seen a media announcement that's gone out today from both the Commonwealth and the state governments, a joint media statement, announcing through the National Partnership Agreement on Family, Domestic and Sexual Violence Responses, funding allocated to 50 workers to bolster frontline responses to domestic violence. So expressions of interest will be invited from organisations to deliver this very vital initiative. And the initiative, as we all know, is being funded through the combined investment of the Commonwealth Government, 16.2 million from the Albanese Government and 4.8 million from the state government. So really the frontline worker initiatives is there to help the workforce to deliver those vital specialist services, and it's really targeting the needs of diverse groups, including First Nations people, those in rural and remote areas, people from CALD backgrounds, people with disability, and the LGBTIQA+ community. So these additional workers will allow WA to build its capacity to respond to women and children in a more timely way, hopefully, and provide those vital resources that we know our specialist services really rely on. The next steps will be that all the requests will be up on Tenders WA. We're expecting that to happen imminently. And the applications will close on the 7th of December. So there's a reasonable amount of time for people to get their applications in. An email will go out to the sector today just to reinforce this information and give a little bit more information. And all the information you really need to respond to this will be in the request document. So it's quite comprehensive with the detail that's got in it. So yes, it's good news, news for WA. I mean, any resources we can get are vital, and we will really welcome this initiative.
Great, thank you, Stacey. So we didn't quite answer the question. So I will ask you, of the 50 new FDV workers that are being funded via the Commonwealth and the state government, how many of these roles have been implemented and how many are within government?
Okay, yeah, good question. None of them have been implemented yet. So I think what Nicole talked about at the last webinar was that a percentage of them were going to be targeted to gaps that have been identified to us. So there is a number of FTE that will go to a targeted response, but the majority will be going out through this expression of interest. So none of them have been allocated at this point in time, and they are totally for sector workers. So this is for our specialised services to be able to get additional resources. Some of the workers will be trainees, so that opportunity to bring new people into the sector, and some of them will be completely trained. So it's a good mix and a good mix of cohorts and covering all of Western Australia. So we hope that it sort of really assists.
Great, thank you, Stacey. Does anybody else have any questions for any of the presenters today? We still have Claire online and obviously Selena and Stacey here with me. Hold on. So there's another question for Stacey. Will these positions be funded at level where remote services can source staff at a level that government departments can recruit at, for example, housing?
Yeah. Okay. Look, of course, you know, the challenges of recruiting have factored very much into this. And I think when you have a look at the request document, you'll see that there's quite a flexible response in there around the funding. We had to sort of formulate a funding out of the what we know about the qualifications required, and we have tried to do that at the highest level we can, so that the quantum of workers that WA needs to provide and report back to the Commonwealth, we can do that, but we've pitched it at the highest amount. So I'd be happy to take any further questions later, but I'd say that the request document will probably assist you to understand how it might apply to your organisation.
Okay, thanks, Stacey. The next question we have is, will the expert reference group be reconvened? Now, I'm assuming this is the one that was stood up as part of the commissioning process?
Yeah.
Yeah. Stacey, can you answer that question?
Yeah, look, I think I can. And it's a good question because it has been paused for a while, and a lot of that was around, there was a lot of work happening with commissioning, and there still is, but there's been other priorities that have probably come in front of that. But of course, it's always there. So yes, that expert reference group will be stood up again. It was never stood down. I guess we just paused it for a while, but it will definitely be coming back into play with the next steps around commissioning and contracting.
Okay, and we have another question, which is kind of related. Given that there have been several new commissioning projects led by the office in the past couple of months, it seems surprising that the commissioning expert reference group has not met. Is the intent that the ERG will provide guidance to commissioning?
Yeah. Yes, I think what's really happened, we can see a lot of activity that's happened over the last few months. It's been an amazingly busy time with both the task force work, so we know that that will generate a lot of activity as well. And yes, through the National Partnership Agreement, we have had opportunities to get additional resources into WA that then turn, of course, into a commissioning exercise. So I think it's Nicole's intent definitely to bring some of this to the expert reference group. We value those opinions that we've got. The National Partnership Agreement does quite often move quickly as far as decision making is concerned, but I think that the answer is yes, we need the expert reference group to be our consultation point again. And I'm sure into the new year, that's where we'll be looking.
I think just to reiterate what Stacey was saying, the task force is definitely a key priority for the office at the minute. That has been the focus for the last couple of weeks at least, and will continue for the life of the task force. But yeah, I think that it's important to recognise that there are other important groups and consultation methods that we need to continue to engage with. So maybe we can take that on notice and provide a little bit more information into the new year. I think we've got another one. So this question is there any chance that existing services can have funding increases? We have not had a funding increase in 12 years, and our geographical area of coverage has increased, as has population and demand. I might just give a general answer first and then maybe hand over to Stacey to provide any other detail. I think that for any individual services, it would be good for you to contact the Department of Communities through your contract manager and to discuss some of these specific concerns that you have or issues that you're dealing with. And we can have a look at that through that mechanism. But in general, Stacey, is there anything else that you wanted to add?
Yeah, look, I think it's totally been acknowledged during the last 12 months through the expert reference groups and other forums, the restrictions for services trying to deliver, great outcomes for women and children. So that's been well recognised. And I think, having a task force, having a deep dive, if you like, or really looking at what's required for this sector across a whole broad range of issues. If we look at the ask of the task force through the Centre for Women's Safety and Wellbeing, there is many points in there about sustainable funding, additional resources, and many other systemic issues that need to be looked at. So I think we probably need these next few months of the task force to do their work. But I would like the sector to know that the office is fully aware of all those issues. We had a bit of an uplift of funding through the last budget, which it wasn't everything we asked for, but it certainly was a good phase one. So we're certainly there in your corner with this. And I think what comes out of the task force will probably direct a lot of our work next year.
Yes. Great. I might just do one last call out for questions. So the FDV Mobile Outreach Program funding is coming to an end early 2024. What is the intention or update for this? We are seeing an increase in severity and serious risk of harm in the community. Is that another question that you can answer?
Yeah, I can to a point. So definitely we know the value of the mobile outreach initiative that has been in operation for a few years now, and we've received a lot of feedback around how those resources across the state have made such a massive difference to the work of organisations and, reaching out to women and children in the community. We're aware of the funding running out. So at this point, many options are being looked at. It's an initiative that we certainly believe needs to continue. But at this point in time, that's really all we can say, other than it's in an internal process at the moment, but totally acknowledged.
Great. Thanks, Stacey. there are no other questions, we might wrap it up for today. We have provided a whole lot of information to you, especially about the cramp. So we'll make sure that these slides are circulated so that you can have a read of the information that was presented. And if that sparks any further questions, please do not hesitate to get in contact with us. The email address is on the screen, or you can contact anybody in the office, and we'll provide you as much information as we can. And I think that's it. Thank you for your time this morning. See you later.